Good habits save people. Let me show you how. A colleague bounced up to me and showed me this skin lesion 78-year-old lady noticed 2 years previously and had been slowly changing. Let's do a quick ABCDE assessment for a melanoma, and we have concerns using the naked eye. From her notes, I noticed she'd had a melanoma removed 2 years previously, which on histology had proved to be an in situ melanoma. Have a look at the dermoscopy. What signs do you see, and what would you do now? The chances of a person who's had one melanoma getting another in the next 5 to 10 years is around 5 to 10%. So is this another melanoma? Without a dermoscope, I'd have been referring her as soon as possible on the cancer care pathway to check it out. Does the dermoscopy reassure you, however? It's pink and brown, and that should make you frown. There's some dot vessels which occur in melanomas, but perhaps these have white halos around. So is this a keratinizing skin lesion, suggested by this light scale over these darker patches? The edge is well demarcated. Is this an area of negative network, a melanoma-specific diagnostic criteria? But look here, did you think this was a pigment network pattern suggesting a melanocytic origin, or are they fissures and ridges pattern of a seborrheic keratosis? I could see no milia flashing up on non-polarized light, and this brown suggests melanin. But is it the network pattern of an atypical nevus, or is the dark keratin within the fissures and ridges of a seborrheic keratosis? I thought this was a seborrheic keratosis, but are we 100% sure? I actually was the one who diagnosed her melanoma initially, and at that time I did a skin survey. I'd found this left thigh lesion. I had saved the pictures to her notes and safety netted her with good advice to report any new changes. This she had done 9 months later, and here's the dermoscopy. It had been evolving. There's still a fissures and ridges pattern at the edges, but the darker keratin in the fissures is increasing. Again, I reassured her. When my colleague brought her to me, I recognized the skin lesion and had a series of images to look back at and reassure myself and the patient that this was just a developing seborrheic keratosis and not another melanoma. Clearly, it was worrying to everyone who saw it, so I decided to take action and with her permission gave it a 30-second cryotherapy freeze. And here's the results 2 months later. Good habits save clinicians worry, manage risk better, and save referrals. Now, you could do that, couldn't you?